Hello, welcome. Thank you so much for coming. It is 7 o'clock on the dot, so we are going to get started to respect everyone's time. So good evening, everyone, and welcome to Bridging the Gap, the Value of Virtual Therapy, brought to you by NAMI Cook County North Suburban, Shawnna Puteney, Senior Regional Clinical Director, and Anastasia Theisen, Senior Regional Clinical Supervisor at Charlie Health. Charlie Health is the largest provider of virtual treatment programs for teens, young adults, and families navigating serious mental health challenges. They provide immediate access, flexible scheduling, and exceptional outcomes, treating anxiety, depression, trauma, self-harm, substance use disorders, and personality disorders. More information can be found at www.charliehealth.com. I am Bree Hoekstra, the Program Director at NAMI Cook County North Suburban. NAMI, or the National Alliance on Mental Illness, is the nation's largest grassroots mental health organization, providing public awareness, no-cost support, and education programs online and in person so that people and families affected by mental health conditions can build better lives. We are a lifeline to individuals and families who do not know what to expect in their difficult life journey. We offer classes, support groups, and do a lot of local advocacies for mental health. Our programs are free and open to those in our community service areas, but we do not turn anyone away who is in need. We are so pleased to have you all here tonight. We are so excited to launch our first 2025 webinar. This year, each month, mental health professionals will further educate us on various topics related to mental health and wellness. Topics will include things like virtual therapy, seasonal affective disorder, mental health in youth and teens, how our physical health impacts our mental health, treatment options, and more. Our webinars are recorded and can be found in our webinar library at www.namiccns.org. This month, we asked Shawnna and Anastasia from Charlie Health to further educate us on the value of virtual therapy, specifically to understand what virtual therapy is and what to expect when exploring virtual therapy as a treatment option, and to obtain information on the benefits of virtual therapy. According to Medical News Today, virtual therapy is therapy that takes place via the phone, an app, a video chat, or even a virtual reality device. Like any treatment option, what works for one person may not work for another. Therefore, there are pros and cons to virtual therapy. According to Forbes, some pros may include more flexibility, increased sense of comfort, benefit for those with physical limitations or disabilities, and more. While some cons can include unreliable technology, some insurance coverage, needing a private and quiet space, and more. If virtual therapy is a treatment option that you are wanting to explore, this presentation explores the transformative potential of virtual care in expanding access to healthcare, improving patient outcomes, and enhancing efficiency for providers. The discussion will cover how virtual care promotes equitable access, enables innovative care models, and supports integrated care through advanced technology. Evidence-based insights demonstrate how virtual care reduces costs, increases patient satisfaction, and optimizes provider workflow. Our Q&A will be held at the end of the presentation. However, if you would like to type questions in the Q&A box during our conversation, please do. We have two guest speakers tonight, Shawnna Puteney and Anastasia Theisen. With 25 years of experience in mental health, Shawnna Puteney is a seasoned professional specializing in trauma-focused care. She holds independent licensure in 21 states, reflecting her broad expertise and commitment to accessible mental health services. Before joining Charlie Health, Shawnna honed her skills across diverse settings, including school districts, private practice, and acute psychiatric hospitals. Anastasia Theisen serves as the Senior Clinical Supervisor for Charlie Health. Anastasia has 8 years of experience as a licensed marriage and family therapist and is currently independent licensed in 19 states. Anastasia has primarily worked in community mental health, eating disorder treatment, higher level of care, and intensive outpatient care, focusing on family systems and trauma modalities. We are so happy to have them both here tonight to further educate us on this ever important topic. So I am honored to welcome our guest speakers, Shawnna Puteney and Anastasia Theisen.
All right. Thank you so much for that introduction. We'll go ahead and get started with the slide overcoming geographical limitations. So since COVID, there's been a massive shift and a momentum placed in the way that we offer services to clients, as stated earlier. And these efforts have been heavily funded and researched since the onset of COVID. So 37% of Americans live in federally designated mental health professional shortage areas. They're also referred to as HPSAs. These regions are where we just don't have enough providers to match the need. So there is a limit in terms of access to care. People go without treatment for mental health conditions, and it just leads to worsening symptoms and increases the crisis situations in those areas. Treatment is often delayed in these situations. Without nearby providers, individuals delay seeking any kind of treatment, and then the symptoms just become more emergent. And as you can imagine, then that just starts a whole I guess waterfall, if you will, of other problems within emergency departments. Now we've got emergency departments that are overrun. Primary care providers are often becoming the first line to people who are seeking mental health support. And many times, some of those providers don't specialize in mental health training, so that can cause issues. And let's see, there's also a pretty significant financial and social strain. Untreated mental health issues can lead to job loss, school dropouts, family disruptions that impact our economy and the stability of our individuals and communities. And there's a social stigma with this as well. So in areas with no providers, stigma surrounding mental health may be exacerbated, skipping over my words here, due to the lack of awareness and normalized conversations. So we also see increased suicide risk in these areas. Suicide rates tend to be higher in areas without adequate mental health services. There's limited prevention, so we're not getting in front of it as much as we should be. And then there is an over-reliance in non-traditional support in these areas. And that, again, can present its own set of challenges. In these areas, it can be really challenging to recruit people. People often struggle to attract and retain talent in these areas. Health providers don't necessarily want to live in some of these areas due to low pay or the lack of resources and isolation. And there's limited infrastructure in some of these areas. So providers who want to practice in these areas may find insufficient facilities or support networks, and even might find it impossible to afford to live there. There are some creative workarounds. So we're going to be talking about that. And it was mentioned earlier, but in some of these HPSAs, we've got telehealth expansion, we've got some mobile crisis clinics, and there's a lot of training that's going on in communities to help move that along. All right, we're going to jump to the next slide here. So 2/3 of HPSAs are in rural areas. The shortage is especially pronounced in areas like Wyoming, where 96.4% of the population doesn't have enough provider resource. And then Utah sits at 83.3%. And that's just a huge shortage. So we can bounce to the next slide. Okay.
And so looking at, COVID specifically really changed the landscape for virtual care. Our world changed very quickly, very drastically, and there had to be a rapid adoption of telehealth to ensure that those who needed care were able to receive it. So in terms of that rapid adoption of telehealth, The pandemic really forced a shift towards telehealth because of social distancing measures and the closure of physical therapy offices, which made therapy more accessible to individuals in areas with limited mental health resources, so those HPSAs. There was some relaxation of licensure laws. Several states had waivers in place to allow for clinicians from other states to practice in that state temporarily in order to increase access to resources. Some examples of that would be Arizona, Delaware, and Washington at the time. Some states continue to have limited waivers in place for treating out-of-state clients. And while many of these measures were temporary, they do really demonstrate the feasibility of interstate telehealth services. Um, and there was an increased demand for mental health services at that time as well. The pandemic profoundly impacted global mental health. It exacerbated pre-existing issues and created new ones for many individuals. There was social isolation, health concerns, economic uncertainty, and significant lifestyle changes that fueled an unprecedented surge in stress, anxiety, and depression. This surge dramatically increased the demand for mental health services, which pushed the limits of an already strained system. According to the Kaiser Family Foundation, the percentage of adults in the United States who are reporting symptoms of anxiety or depressive disorders increased from 11% in 2019 to over 41% by early 2021. And similarly, the CDC did document significant rises in substance use and suicidal ideation during this period. Also during this period, people began prioritizing therapists with specific expertise or competencies that aligned with their needs. So, for instance, individuals from diverse cultural backgrounds increasingly sought professionals who would understand their unique experiences. Similarly, those who spoke English as a second language often preferred therapists with linguistic capabilities to ensure effective communication and cultural sensitivity. And because of some of the relaxation of licensure laws and the adoption of telehealth, they were able to find that more often. This slide is really just showing that before March of 2021 and then after the CARES Act and the CMS 1135 waiver were put in place, we saw a really significant shift in telehealth regulations. So before March of 2020, really only certain licensed providers could engage in telehealth services for Medicare and Medicaid. And now it's any type of clinician. Previously, it was only patients and providers with a pre-existing relationship, and now that's not required. Um, Before the pandemic, it was only at pre-specified sites. So the focus was really on rural areas. And now that has relaxed as well. Physicians used to only be able to conduct from place of practice, and now they can conduct from their home. Previously, they were not able to cross state lines, and now they can. It used to have to be audio visual, so video did have to be required, and now audio only is allowed. Additionally, previously only approved technology platforms were allowed, and now there was an expansion on that. Medicare, previously the coinsurance and deductibles would apply, and now providers can waive cost sharing. And then previously the reimbursements were lower than in person, and now in most cases they are reimbursed at the same rate. So we saw a lot of really significant changes. Some more aspects of this are permanent policy changes. So some states and insurance providers have updated regulations to accommodate telehealth long-term. So some compact agreements like the Interstate Compact for LPCs are being implemented, which can allow therapists to practice across state lines more easily. LMFTs, unfortunately, do not have a counseling compact and are not really moving in that direction at this time. The route that they've chosen instead is one of strategic portability. So basically, just trying to make it a little bit easier to move from state to state, remove some barriers to licensing portability. In terms of convenience and accessibility, virtual therapy can eliminate some geographic barriers, which makes it easier for clients to find therapists who align with their needs. This has been particularly beneficial for rural residents or people with mobility challenges. There was a study published in the Journal of Telemedicine and Telecare, and it found that virtual therapy significantly improved access for individuals with mobility limitations, with many participants reporting reduced stress and logistical burden when accessing care from home. Clients have also expressed high satisfaction with virtual therapy, which can be really good to see in terms of its continued use. A study from 2021 in the Journal of Medical Internet Research reported that 80% of participants in the study found that teletherapy was as effective as, if not more effective than, in-person sessions. Many clients really appreciated the convenience, the flexibility, and even the increased sense of privacy afforded by virtual sessions. This slide is showing some statistics. So the first statistic is that 30% of people have used telehealth services to meet up with a medical or mental health professional, which is up from 31% in the fall of 2020. 82% of those using telehealth services have used the services since the start of the pandemic, which shows just the consistency in the telehealth care provided. About 69% are using telehealth through a video format, and 38% are using phone calls only. So that, I think, also shows just the variety of options available for therapy in the virtual world.
Yeah. Great. Thanks, Anastasia. So we really don't know what the lasting impact is going to be with regard to COVID. We do know that our youth in the United States are very likely to be the hardest hit in the nation. And I anticipate, and many studies are pointing towards the fact that they're probably going to experience the longest duration of symptomology in the country. So, you know, time will tell, and we'll see, but it's certainly pointing in that direction. All right, so if we go to the next slide, 90% of adults in the United States believe that the country is facing a mental health crisis. Research regarding anxiety and depression just indicates that during the pandemic, anxiety symptoms really were around 7% to about 51% of individuals, while depression symptoms ranged anywhere from 15% to 48%. So these figures represent a significant rise compared to pre-pandemic. PTSD symptoms have also risen. They were observed around 7% and then increased to about 54% of the population during the pandemic. And this really just highlights the psychological impact of the crisis that we're facing. Young adults, this is an interesting statistic. So they had elevated distress. There was a Pew Research Center survey that found 58% of Americans that were in the age range of 18 to 29 experienced really high levels of this distress than prior to pandemic. Workplace stress increased. Another survey revealed that 35% of workers aged 18 to 24 took time off due to stress or emotional distress in the past year, compared to only about 10% of workers aged 55 and above. And again, our hardest hit area, children and adolescents, really just seeing a lot of deteriorating mental health. Studies from the University of Oxford indicate that young people experienced increased depression and behavioral difficulties during the pandemic, with a more significant decline in mental health compared to adults. And as we all know, healthcare workers really were hit hard as well. There was increased anxiety and depression, especially for those frontline healthcare workers. They reported higher levels of anxiety and depression during the pandemic, and really attributed that to increased workloads, risk of infection, and just witnessing patient suffering. Okay. So we're going to go into this next slide. So adolescents, and I'm going to base this on ages 12 to 17, were experiencing more emergency room visits for suspected suicide attempts. And data, from the CDC indicated that during February 21 to March 20, 20th, 2021, suspected suicide attempts were roughly 50% higher among girls in this age group compared to the same period in 2019. And among boys aged 12 to 17 years, there was a 3.7% increase in suspected suicide attempts. Young adults 18 to 25, they remained relatively stable when compared to data from 2019 and 2020. However, the rate of these visits per 100,000 visits was higher throughout the pandemic compared to 2019. So I just want to talk a little bit about some of the biological vulnerabilities. So there's, weakened immune system, comorbid physical conditions, medication effects, and there's some behavioral factors as well. So smoking, substance use, poor diet, physical inactivity, are more prevalent among individuals with serious mental health conditions, and this just really increases their vulnerability to severe illness. And then folks who are non-adherent to preventative measures also can be concerning. There are some social and environmental determinants. So people who live in group settings or institutions, such as psychiatric hospitals, group homes, or shelters, where COVID-19 transmission rates were higher. We saw higher rates there. Homelessness and housing instability, unhoused individuals are disproportionately affected by severe mental illness and face challenges accessing healthcare and maintaining hygiene and isolating when necessary. There's also some systemic barriers to healthcare. So delayed medical attention, which I touched on a little bit earlier, limited access to care, and then reduced an ability to take vaccines or medications. So let's see here. The impact of isolation and disruption of services really disrupted support networks for people. The lockdowns and social distancing measures interrupted access to mental health services, support groups. People couldn't see their case managers, leaving individuals without their critical support. And it really did worsen mental health in our country. So when people estimate that there's a problem, 90% of Americans think that there's a bigger problem. There definitely is. We are seeing higher mortality risks. Studies found that individuals with severe mental illnesses, particularly schizophrenia, were at significantly higher risks of dying from COVID-19, likely due to a combination of all of these factors. And then again, hospitalization gaps. People with serious psychiatric disorders were often hospitalized later in the course of COVID-19 when treatment options were more limited. So many people who had long COVID were misdiagnosed with psychiatric conditions due to a lack of definitive medical tests. And this also led to inappropriate psychiatric admissions in the country.
So the United States is currently facing a significant shortage of mental health professionals, and there's an estimated need for an additional 8,500 to 10,000 providers to meet demand nationwide, which is a pretty big number.
It's a huge number. So, all right. So this is a lot of common sense information here, but virtual therapy really is alleviating provider shortages by expanding access for everyone. So people have increased flexibility. They have more control over their schedules. Virtual care just really allows providers to set their hours and manage appointments in ways that fit their personal and professional lives. People are indicating that it's more of a work-life balance. They're eliminating the need for commuting. They don't have to work those long clinical hours, and providers really can spend more of their time doing what they love, which is therapy, spending time with their family, and participating in the things that really interest them. And the value of virtual therapy is it really reduces administrative burden. It streamlines processes. Many of these new telehealth platforms integrate appointment scheduling, note-taking, billing, and documentation, and it just saves providers a lot of time and reduces some stress. There's a lot of automation, so features like automated reminders and digital record keeping decreases the manual work overload. And there tend to be lower patient no-show rates. Uh, so really, we're seeing some improved attendance. Patients are more likely to attend their virtual sessions since they can do it from home. And it really reduces gaps in the provider schedule and the frustration from missing appointments. Um, and we're seeing increased access to clients. So as we were introduced, you all heard that I have 21 licenses, Anastasia has 19. So it really does impact our ability to see more people. We can serve more clients without, ever leaving our homes. So, and again, broader reach. We have much broader reach. So it also reduces exposure to stressful environments. So there's fewer in-person stressors. Providers can avoid, high stress environments like the emergency rooms, high demand clinics, or overcrowded waiting rooms. It's very comfortable to work from the home. It's also comfortable for clients to see patients. They're, sitting in their beds with their pet next to them. And it seems that they're very comfortable expressing themselves and talking with their providers. So we're also mitigating some emotional strain with boundary setting. Virtual platforms make it really easy to maintain professional boundaries, such as defined session times, and it also limits the emotional toll of in-person crises. And there's support resources. So many platforms offer integrated tools like mental health tracking or peer support for providers and even for clients. Some also offer crisis hotlines. And there's an enhanced collaboration. So with peer support, virtual platforms often allow for quick case consultations with colleagues, and that just reduces feelings of isolation and fostering a sense of teamwork among each other. And access to supervision is great because providers can seek supervision or mentoring remotely and really just helps them handle complex cases more confidently. It does save a lot of money, so there's huge cost benefit here. No commuting costs, providers save time and money that's typically spent on traveling to a physical office. Lower overheads, so many providers avoid paying for office space, utilities, or other operational costs, and that can reduce financial stress for folks. There's flexibility for self-care. So there's opportunity for clinicians to take short breaks. There's time saved from commuting or administrative work, and it can be used again for personal breaks and exercise or just being mindful and getting ready for the next session. There's some mental recovery time. And what we have seen is improved job satisfaction. So regarding patient outcomes, providers often feel that more effective when they feel that they've helped clients overcome barriers and they can provide more access. Folks also feel very autonomous. Virtual care empowers providers to really tailor their practice and their approach and feel confident and good about what they can offer. And it's expanding access to niche expertise. So, as mentioned earlier, Anastasia specializes in eating disorders. And so a lot of people don't have access to that. And that's something very special about Charlie Health as well. We have specialists across geographies, so virtual therapy connects clients with specialists in these areas. So you might have somebody who's struggling with trauma and they might need trauma-focused CBT or LGBTQI plus issues, and they may not be locally available. So with these platforms, folks can't access these types of care. And Anastasia talked a little bit about the language and cultural expertise, which is really important in these HPSAs. It's just not there. And so this is another way for us to meet the need. The other thing that's really great with these platforms is clients can be matched to the right therapist. So there's some algorithmic matching that's taking place. Telehealth platforms often use technology to pair their clients with therapists based on their needs, and it really ensures specialized care. There's national licensure flexibility. Providers licensed in multiple states can offer their services to a wider range of people. Um, and group therapy is great for specific needs. So there's focused groups that enable people that need to target specific issues like substance use, grief support, or parenting. And then there's also peer support. Um, the other thing that's really special, I would say, about all the telehealth platforms, but in particular Charlie Health, we do offer some trauma-informed care. So there's people who specialize in this, people that specialize in EMDR or somatic experience, and this all can be done remotely. So that's pretty exciting. There's really some innovative approaches. Providers can incorporate cutting-edge approaches like dialectical behavioral therapy, cognitive processing therapy, or acceptance and commitment therapy through all kinds of different virtual platforms. And it's easier to access second opinions as well. So clients really seem to appreciate that. And then there's greater flexibility for multidisciplinary and disciplinary care. So there's integrated treatment teams. It's easy for psychiatrists, case managers, and providers to all work together in one space and consult on their clients. There's a lot of collaboration on the intervention, so it just tailors that to our clients. And we can deliver highly specialized care plans for complex issues like co-occurring mental health and substance use issues. And really just the whole process has a broader range of tools and resources. So the idea of virtual therapy really does support rare conditions. So there are some rare diagnoses that many people don't have specialties with. So it could be a dissociative identity disorder, could be PTSD. So there's all kinds of things that people specialize in. All right. I think we can move on to the next slide, Anastasia.
All right, so now we'll talk a little bit about improving patient outcomes. So Shawnna just talked a lot about some of the benefits of telehealth. It can help reduce the influx of demand. It spreads out resources. A study in the Journal of Psychiatric Services highlights that telehealth can alleviate the pressure on overburdened systems by improving appointment availability, especially in those HPSAs. It can also decrease the number of secondary or tertiary diseases. Effective mental health care through telehealth can mitigate the development of secondary or tertiary diseases related to untreated psychiatric conditions. So untreated anxiety and depression are linked to cardiovascular diseases, diabetes, and other chronic illnesses. But timely virtual interventions can help prevent these cascading health issues by providing early support and consistent care. And a report by the World Health Organization underscores the importance of accessible mental health care in reducing comorbid conditions, particularly during crises like the COVID-19 pandemic. It can also reduce the loss of follow-up among psychiatric patients. So telehealth reduces the likelihood of patients missing follow-up appointments, which is a common issue in mental health care. By removing some of these logistical barriers like traveling or scheduling conflicts, telehealth really ensures continuity of care, which is really critical for managing chronic psychiatric conditions like bipolar disorder or schizophrenia. And then according to a study in the Journal of Telemedicine and eHealth, patients who received care through telehealth were significantly more likely to attend follow-up appointments compared to those who were relying on in-person visits alone. There's reduced barriers to transportation. The National Institute of Mental Health highlights transportation challenges as a primary barrier to accessing mental health services and emphasizes telehealth as really a key solution to this problem. Telemedicine makes mental health services more accessible, It also helps patients avoid stigma and get treated from the privacy of their own home. Being able to be around supportive animals and familiar items can enhance the therapy experience for some. Um, and then looking at virtual therapy's role in providing consistent care, regardless of patient mobility or scheduling conflicts, again, allows for more flexibility for patients with scheduling. They don't have to account for that travel time, which can be really significant, stressful. It allows for that more consistent care to occur and can also increase the likelihood that clients are able to find providers with whom they're comfortable. And then patients with mobility concerns, including those with chronic illnesses, disabilities, or even caregiving responsibilities, don't have to worry about whether or not their therapist's office has adequate support for their mobility needs. And it also reduces the pain and discomfort and stress that traveling to an appointment can lead to. By removing the need for travel, telehealth makes therapy accessible for those who might otherwise struggle to attend in-person sessions consistently. For example, a study published in the Journal of Telemedicine and Telecare found that virtual therapy significantly improved access for individuals with mobility limitations, with many participants reporting reduced stress and logistical burden when accessing care from home. So how virtual therapy allows for a more personalized treatment by meeting patients in their own environments. It really allows for opportunities to build rapport. You can ask clients to show them important items from their home and from their life. For many patients, receiving therapy in a familiar setting like their home can reduce feelings of vulnerability or intimidation that can often be associated with really overly clinical environments. This comfort can lead to greater openness and honesty during session, and it can enhance therapeutic outcomes that way. The APA emphasizes that the comfort of home can help patients feel more at ease, particularly those dealing with anxiety, PTSD, or agoraphobia, thereby improving their ability to engage in therapy. Virtual therapy sessions conducted in patients' homes provide therapists with really valuable insight into their clients' lives. Therapists can actually observe aspects of their patients' daily environments, like their living conditions, their household dynamics, and even stressors that might not really come up in conversations during in-office visits. These observations really allow for a deeper understanding of the patient's circumstances, and it also enables the therapist to create treatment plans that are better suited to the client's needs. A 2021 study published in the Journal of Medical and Internet Research highlights that home-based virtual therapy helps therapists gain a more accurate perspective of the client's environment, which can improve the effectiveness of therapeutic interventions. Related to clients and caregivers or parents, therapists can observe family interactions in real time, allowing for more effective strategies in family or parenting therapy. A lot of times it can feel like our clients and their parents or caregivers are coming in and we're really only seeing a small snippet of their life, and they may not necessarily be presenting 100% naturally like they would in their home environment. So you get more of that opportunity with virtual care. In terms of patients with physical disabilities, as we talked about before, virtual therapy really enables therapists to offer suggestions tailored to the patient's specific home setup. So it allows therapists to maybe identify some mobility access needs that are missing from the home, and how can we get those resources to the client. And clients with hoarding disorders. By conducting sessions virtually, therapists can directly address the organizational challenges within the client's living space and provide actionable interventions in real time to address these. Looking at ensuring flexibility and comfort for patients and how it leads to higher satisfaction and better outcomes. Clients are able to have their pets or other comfort items immediately available to them, which can increase their willingness to engage in vulnerable conversation, can feel a little safer for them that way. And then looking at a study conducted in 2021, comparing the efficacy of telehealth to in-person mental health care in intensive treatment seeking adults, the results suggested that telehealth was a viable care alternative with no significant difference between in-person and telehealth groups in depressive symptom reduction and significant increases in self-reported quality of life across both groups. Specifically, patients in the partial hospitalization level of care actually stayed longer when their treatment was remote.
Okay. So we know that there are some key insights from studies. So there's a huge depressive symptom reduction. Uh, and we're really noticing that there's no significant difference between telehealth and in-person care in reducing the symptoms of depression. So for instance, randomized controlled trials and meta-analysis of telehealth interventions, like CBT, for instance, whether it's delivered in person or online, there isn't any big discrepancy about the outcomes. There's improved quality of life, and we've kind of talked about that, so I don't want to pound that into the ground too much. Anastasia covered that quite a bit. Again, you talked about engagement and retention, so clients really do tend to attend their appointments. It's just more feasible for them. So I think we can move to the next slide here. So again, we're going to talk a little bit more about improving efficiency for providers. There are amazing things happening in the healthcare space with AI. I'm sure a lot of people have heard about it. It makes some people pretty nervous, and some people really love it. But the implementation of things like AI Scribe has been hugely impactful in decreasing, again, the administrative time that we're using as clinicians. And there's just a few that I want to share. Now, I do want to preface this is not an all-encompassing list. This is just a list of some that I am aware of. But Freed is one AI scribe that listens and transcribes and writes medical notes for clinicians. It's HIPAA compliant and it offers just some different trials. Suki is another one. It's a voice-enabled digital assistant that handles administrative tasks using the natural language processing. It integrates with popular electronic medical health records, and just really reduces time for folks. The other one is called Tally AI, and it's just an AI assistant that streamlines clinical documentation by generating detailed clinical notes from patient interactions. It describes notes directly, or it transcribes notes directly into the EHR and provides quick access to medical information. Navia Copilot is an ambient AI assistant that reduces practitioner burnout by transcribing conversations into written transcripts, and it works both in person and online. So another one is Upheal. It's an AI-powered progress notes tool designed specifically for mental health professionals. It helps with therapy session notes. And again, these are not something that a therapist wouldn't want to look through before they put a note in the chart. It's just an assistant. So they're still going to put their touch on everything. Another one is called Elio Scribe. Again, it's an AI documentation assistant that just helps with charting and notes. I think JotPsych is another one. It's really tailored for mental health professionals. So there's all kinds of things out there that are really assisting therapists and making their lives much easier. And I think we can go to the next slide.
Okay. So Shawnna talked about some of the benefits to providers for virtual therapy. So looking at some of the virtual care's potential to lower overhead costs, we talked a little bit about that. But the cost of mental health services in the United States is really substantial, which reflects both the direct expenses of care and the broader economic impact. So virtual care can actually lead to lower costs for patients. It essentially eliminates many of the out-of-pocket expenses that they incur when attending in-person appointments, like fuel, parking, public transportation fees, which is particularly impactful for those who live really far from mental health facilities. Childcare expenses. Parents can attend virtual therapy sessions from home without the need for babysitters or daycare services. It's a time saver, as Shawnna mentioned, reduces time spent commuting and waiting. And a study published in the Journal of Telemedicine and Telecare found that patients attending virtual therapy saved an average of $40 to $60 per session compared to in-person visits, primarily due to reduced travel and associated expenses. And Shawnna talked a lot about the reduced overhead costs for providers, the facility expenses, administrative costs. And then the APA actually reports that providers offering virtual therapy see a 20% reduction in overhead costs compared to in-person practices. There's also decreasing systemic healthcare costs that virtual therapy can offer. It can lower broader healthcare expenses by enabling early intervention and consistent care, which reduces the need for more intensive and costly treatment later. So some examples: fewer emergency room visits, reduced hospitalizations. Patients with chronic psychiatric conditions like bipolar disorder or schizophrenia often require hospitalization when care lapses. Consistent virtual therapy has been shown to reduce hospitalization rates by ensuring ongoing management of these conditions. And a study published in Health Affairs found that teletherapy services reduced emergency room visits related to mental health by 25%, leading to significant cost savings for hospitals and insurers. And looking at the general cost of mental health care, the impact of mental health care in this country, untreated or poorly managed mental health conditions like depression significantly impact workplace productivity, with losses estimated at $44 billion annually. And then more recent studies actually suggest that the total economic burden of mental illness in the United States has risen to approximately $282 billion annually. And there is a graph on the total amount of state mental health agency expenditures in every state. As you can see, there are some states that are upwards of $7 billion, which is pretty significant. So how virtual therapy supports coordinated team-based care through telehealth platforms. These platforms often include features like sharing patient records, messaging systems, video conferencing, which really enables real-time collaboration among therapists, psychiatrists, primary care physicians, and other specialists. There was one study that highlighted how such platforms improve communication and coordination in team-based models. That study was in the Journal of Telemedicine and Telecare. Virtual therapy facilitates the development of holistic care plans by centralizing patient data. For example, some platforms like Teladoc Health and Amwell integrate EMRs, enabling seamless sharing of treatment progress and updates across teams. Epic is an EMR that does that as well. The APA emphasizes the importance of shared EMRs in delivering coordinated care. And then many telehealth platforms incorporate tools for monitoring patient progress through digital assessments and feedback loops. These tools enable teams to make data-driven decisions collaboratively. And according to a 2023 review in telemedicine and e-health, such functionalities led to more timely interventions and better patient outcomes. Virtual platforms also serve as educational tools for team members. There can be features like webinars, shared training modules, and case discussion forums, which promote interdisciplinary learning, which strengthens team-based care.
All right. So I'm going to talk a little bit about some innovations in virtual care, and this is a pretty exciting topic. So we can go to the next slide. All right. So one area that really is fascinating in this arena is AI and how we work with OCD clients. Now, there's many different diagnoses where AI is really helpful, but this is one that just fascinates me. So So this is why I chose OCD, but it's being used increasingly across the mental health field. Obsessive compulsive disorders really just strikes across the nation in big, large numbers. So um, with regard to accelerating the OCD diagnosis, researchers at Stanford University have explored the use of large language models to expedite the diagnosis of OCD. And by analyzing patient data, these AI models can assist clinicians in identifying OCD symptoms more quickly, enabling earlier intervention and potentially improving long-term outcomes for patients. And with regard to enhancing treatment monitoring, the development of wearable AI feedback tools, such as something called the Wrist Angel, allows for continuous monitoring of those OCD symptoms. And these devices can detect physiologically and behavioral indicators associated with OCD, providing real-time feedback to the patient and the clinicians. And this continuous monitoring really facilitates more targeted and timely interventions, optimizing the effectiveness of treatment like cognitive behavioral therapy with exposure and response prevention. It really does improve treatment outcomes. So AI is also being utilized to refine OCD treatment strategies. By analyzing large data sets, AI can identify patterns and predictors of treatment response, helping clinicians tailor interventions to their patients. And this personalized approach aims to enhance the efficacy of treatment and reduce the trial and error period that's often associated with finding the most suitable therapist. With regard to addressing potential risks, AI offers promising tools for managing OCD. There are concerns about its impact on individuals with the disorder. Some experts caution that certain AI applications, particularly those involving machine learning algorithms, analyzing personal data, could inadvertently exacerbate OCD symptoms or trigger new obsessions. So that's something to keep in mind. And ongoing research is essential to understand the risks and develop some guidelines to ensure AI tools are used safely and effectively with regard to the OCD population. So in summary, AI really is poised to revolutionize the diagnosis of treatment, specifically among OCD clients, by providing faster diagnosing, enabling continuous symptom monitoring, and facilitating personalized treatment plans. And it's also crucial to balance these advancements with careful consideration of potential risks to ensure the well-being of our individuals that are struggling with OCD. Artificial intelligence is increasingly being integrated into exposure therapy, particularly through the use of virtual reality. It's really cool to see the goggles that people are wearing, and they're having some small exposures to some things. And the integration allows for more personalized, adaptive, and efficient therapy interventions. All right, go to the next slide. Okay, so Charlie Health and other online companies have found unique ways to cater to a variety of different modalities. And this is typically not offered in one location. So many companies are offering full wraparound care for clients without ever having to leave the comfort of their homes. And some of the specialties are that are being offered are tracks for maternal mental health. There's a military track, trauma-focused cognitive behavioral therapy, dialectical behavioral therapy, cognitive behavioral therapy. There's tracks for folks that are neurodivergent. There's family therapy support groups, and a full range of art therapy, music therapy, and contemplative practices. So it's really astounding and great to see so many different offerings in one place. Okay, so multivariate treatment mapping is only possible when there's a very large number of clients. So we often refer to this as CAMEL, which is condition. So it's something that the client is diagnosed with. Their age, we like to pair people based in groups based on their age, and the modality of treatment that they're utilizing, and of course their lived experience. Anastasia, do you want to add anything to that at all?
I think, especially looking at the age groups and matching within those, and then also in the different tracks that Shawnna was talking about, we've seen a lot of different progress in those areas. And we've also started looking at trying to use features like AI or technology to better match people in groups as well, which has had a lot of success. And there's also some challenges to that. So I think that there's maybe some kinks to work out, but I think overall this is a really exciting development in teletherapy. All right. Looking at some evidence-based insights. So there's long-term financial benefits, including reduced hospitalization rates, better patient management. So as we've talked about, virtual therapy can prevent crisis situations. It enables early intervention and continuous monitoring, which reduces the likelihood of patients requiring emergency care or hospitalization for mental health crises. There was a 2021 study published where it was found that patients using teletherapy services experienced a 32% decrease in hospital admissions compared to those receiving only in-person care. This reduction translates into significant cost savings, as psychiatric hospital stays are among the most expensive healthcare services. For patients with comorbid mental and physical health conditions, virtual therapy has been shown to reduce hospital readmissions. So research by the National Institute of Mental Health highlights that integrating behavioral health care through telehealth platforms reduced overall healthcare costs by 25%, driven primarily by those fewer hospitalizations and emergency room visits that we were talking about. And then telehealth platforms provide tools for real-time monitoring of patient symptoms, even adherence to treatment plans and medication management. This ongoing engagement really reduces complications and prevents exacerbation of conditions. A 2020 report by McKinsey and Company estimated that virtual therapy reduces the total cost of care by up to $7,000 per patient annually due to better disease management. We see higher patient satisfaction rates and engagement rates in virtual settings, oftentimes due to the convenience and accessibility that it offers. So convenience really does drive those higher satisfaction rates. There's flexible scheduling. It provides flexible appointment options, allowing patients to fit sessions into their schedule without disrupting daily responsibilities. A 2021 survey published revealed that 88% of respondents rated teletherapy as more convenient than in-person therapy, citing reduced travel time and scheduling ease as those primary factors. The elimination of geographic barriers, as we discussed before. So patients in those rural or underserved areas really benefit from access to specialized care that might not be available to them. And then according to a 2022 report, telehealth platforms increased satisfaction among rural patients by 73% due to the removal of travel-related challenges. There is improved accessibility, which enhances engagement rates. So there's that reduced stigma and anxiety. Virtual therapy really allows patients to seek care from the comfort and privacy of their own home, which can reduce stigma and anxiety associated with visiting a physical clinic. Research from the Journal of Medical Internet Research found that 67% of participants were more likely to engage in therapy sessions when conducted virtually compared to in-person settings. And then accessibility for diverse populations. Telehealth platforms provide features like language translation, closed captions, and user-friendly interfaces, making therapy more accessible to individuals with varying needs. The American Journal of Public Health highlighted a 50% increase in engagement rates among non-English speaking patients using telehealth platforms with integrated translation services. And then there's that consistency and retention in care. There's reduced missed appointments. The convenience of virtual therapy has been linked to lower rates of missed appointments by about 35%. And then enhanced provider-patient communication. There's secure messaging, sometimes video check-ins, progress tracking tools, all of which can keep patients engaged. And this ongoing interactions fosters a stronger therapeutic alliance, which is really critical for long-term success in therapy.
Hey. So the future of virtual therapy is bright. One positive thing that came out of the pandemic was the fast learning curve of how to implement virtual care, and companies really were adaptive. And there's all kinds of new ideas and technology out there now as a result of this. Okay, so if we go to the next slide. So virtual therapy and traditional healthcare systems can work together in a complementary way to provide more comprehensive, accessible, and personalized care for patients. And here is how they can integrate effectively. So it can expand access and reduce barriers to care. And we've kind of talked about how that happens. Traditional healthcare systems can refer patients to virtual therapy when in-person visits are not possible, or when patients are in underserved areas. We've again covered all of that. And there are some new hybrid models out there now in terms of care. So virtual therapy can be used as a supplement to traditional in-person care. A client may see their individual therapist, but then may be participating in group therapy elsewhere to get that component of therapy. And Anastasia touched on continuity of care, so I'm not going to go through that, but really, I think integrating data from all modalities is great. So we're seeing electronic health records from traditional healthcare systems that include notes from virtual therapy sessions, and it's ensuring that clinicians have a holistic view of the patient's treatment history. The AI tools are being used and can be employed to analyze data from both the virtual and in-person sessions, identifying patterns and informing treatment adjustments. And this shared information can provide clinicians with a fuller picture of what's happening with the client and really enables more personalized care that spans both mental and physical health. And one of the most important things is there's an element of crisis management and urgent care. So virtual therapy can provide real-time intervention for patients in crisis, offering immediate support and helping with a de-escalation or emotional regulation. Traditional healthcare systems can act as a backup for when virtual care can't address physical emergencies or complex mental health crises that require immediate in-person intervention. And both systems working together in tandem can create a robust crisis management strategy, ensuring that patients are cared for across various settings and at different times. And I think that this also provides an opportunity for providers to collaborate in a way that we never have previously. There are patient care centers now where providers can communicate. This offers patients flexibility to choose between virtual or inpatient sessions. There's also opportunity for patients to engage in other ways. So lots of neat things going on here. I think we can move to the next slide. All right. So steps to equip healthcare providers with the necessary tools, training, and infrastructure for virtual care. There's a lot of policy things that are happening right now. There's reconsiderations of how we previously did things. There's some reimbursement models and a lot of regulatory framework for widespread adoption. There's some new licensing things that are on the horizon. Anastasia, it's on the tip of my tongue and I cannot think of it. I know the social workers are doing it. Do you
The
recall them?
compact?
Yes, the compact.
Yes.
Thank you. Yeah, so that's something exciting that is on the verge. And so if you're not aware of that, Google it, check it out. It's pretty exciting. So, all right, I think we can go to the next slide. So there are some challenges that have to be addressed. While virtual care has immense potential, there's also some limitations, as we've discussed, such as digital literacy. There's still people that don't know how to use computers, don't have access to Wi-Fi. And so there might be some educational components here that could be used in communities. And there are programs like government subsidized internet access or device distribution that can help close that gap for folks. So I think with that, we'll go ahead and take questions if there are any.
Well, thank you both so much for providing all that information. It's wild how much this is becoming a more popular and innovative approach to therapy. So, even you talking about the AI aspect of it, it's so incredible that, our technology has become so advanced that we're able to do some of these things. I know personally, I have a few friends who are therapists who do telehealth. And, one of the things that they mentioned is just, the burnout that comes with not only the practice itself, but taking the notes and, reflecting and all of these things. So I'd be interested in, kind of learning more about the AI aspect for healthcare providers to take those notes and kind of, I don't know, speed up that process, if you will. Have you seen any, benefits, also like drawbacks of that system helping you with notes like that? Does it, I don't know, like, does it make it a little less personal, or is it, they have more opportunity to, be fully engaged with the person that they're talking to? What have you seen with that type of technology?
Yeah, that's a great question, and I can speak to that, and I'll let Anastasia speak to it as well. But our clinicians really have it has decreased burnout. I'll just say that. So when they're utilizing AI, it's been such a great tool. They can be more invested in the session. They're really listening, and I think that clients feel that. Also, the where was I going with this? Anastasia, I know that you can read my mind. You have this ability to do it. Where was I going with
Yeah,
that?
I was kind of thinking about like the first part that you brought up of just like it definitely has decreased burnout. I think some of the you were kind of wondering about maybe some of the challenges. I think some of the challenges that we see are patients or clients maybe aren't always necessarily comfortable with the AI aspect. So there is some education that's needed. And we always want to respect the client's ultimate, decision on that. We're not going to record and do notes with AI if they're not comfortable with that. But a lot of times it's just reassuring them of like how the data is kept. And so being aware of that as a provider, like, how am I keeping this person's data? Like, where is it being stored? How am I making sure that I'm following HIPAA guidelines on that and making sure that it's got the dual locks and everything? So that's a big consideration. I would say for the most part, AI really like captures the session beautifully. The transcript is very accurate. The summary of the session tends to be very accurate. We hear a lot of our clinicians saying like, I didn't even maybe necessarily realize I was using that intervention. But like the AI kind of picked it up. So that's been really cool to see. Some limitations that we see with AI in that aspect are maybe in more of like the group setting. We are piloting some group note AI, that system right now. And so there were a lot of kinks to work out just on making sure that AI was picking up conversations and kind of putting it with the right person, and putting the summary with the right person. So there was a lot of that we had to figure out. But I think our team has done a really great job with figuring that out.
That's so interesting. You listed a bunch of different platforms. I'm wondering if you're comfortable, would you mind sending those resources out to me? And if we have any healthcare providers that are interested, in that, we can provide that information. Is that something that you're willing to do?
Absolutely. Yeah, I'll email you all the different AI resources that I'm aware of. Again, it's not a comprehensive list, but it's just some that I'm personally aware of.
Too, if, one of the things that you mentioned was maybe like a lack of knowledge or a lack of training. Do you know if there are organizations that provide trainings like that, or do you all provide trainings like that? It's probably such a new thing that might not even be a thing. I don't know, but just curious.
Like in terms of digital literacy as a whole, or in terms of like just education around the AI aspect?
I was thinking specifically the AI, but you did say that a challenge with, telehealth in general is digital literacy. So I guess all of it would be helpful.
Yeah, that's a good question. I am not aware of any like specific resources, but I'm sure that's something that we could look into and get to you, email you as well. I know there's definitely some efforts made in some states, like just in terms of government policies around like, subsidized internet, especially for senior citizens and things like that, programs to try to help um, improve their access, but not necessarily like the digital literacy piece, I think is missing on the government level.
Yeah, for sure. Well, thank you. I appreciate that. There was a couple other questions that I had, and one of them was actually related to burnout. And we just hear so much about shortages, right, of healthcare providers, especially in the mental health field. Have you noticed that with telehealth, there is more access? Are there shortages for mental health providers in the telehealth field? And I don't know, like just kind of thinking along the lines of, the burnout and the access. Are you seeing any improvements with this new initiative?
I would,
Oh, go
oh,
ahead,
Shawnna, you want
Anastasia.
to? I was going to say, I think there has been an improvement. I say that cautiously because I think that the boundaries piece is very important, and Shawnna spoke to that there is the ability to maybe set clearer boundaries in the virtual setting. Like, hey, this is our session time, like the link is for this long, type of boundary. But I think there can also be maybe some boundary relaxation that happens, like being more available to your clients than maybe you previously were. And I think that's something that providers would need to be aware of, and be able to implement that boundary for themselves, in order to reduce their own burnout that way. But I would say overall, I would say it has reduced burnout. Like, you are in the comfort of your own home as well a lot of the time. You have your familiar items, you have your pets around me. I don't know if you heard my cat screaming outside of my office a while ago. Thank goodness you didn't hear it. I had a sound machine on because I knew she was going to do that. But I mean, she's both a blessing and a curse, but I can have her around me as well, which is really helpful. If there's maybe like a session that was really challenging, or a lot came up for the client, like I have that there as well. So I think that can help with the burnout piece.
Co-regulation at its finest.
Yeah.
It's funny that you mentioned that because I myself am in telehealth, and my therapist has a cat that pops up, and it almost makes it a little bit more personal, right? Like you see your therapist's life, and you were saying the vice versa in your presentation, that you can see your patients and your client's life, right? And I think the same is in the reverse. It makes it just feel more personal. So it's funny that you mentioned that about your cat, because she's always
Yeah.
up and saying, hey.
Yep.
Well, that's great. Thank you so much. You did mention, last question I have, I jotted down, what happens with the individuals who just don't have access to technology and Wi-Fi. And I know, Shawnna, you mentioned this in one of in one of the slides, some resource that you can utilize in order to get those materials. Can you refresh my memory on maybe what that is? Are there organizations that provide technology in the event you don't have it specifically for telehealth?
Yeah, there are some companies that if you're in therapy with them, excuse me, will provide some resources. I know at Charlie Health, if we have a client that does not have uh, electronics, like we will provide a tablet. So yeah, so different companies offer different things.
Yeah, that's wonderful. Very good to know. So I guess, do your research, ask the questions, and all the above. It sounds great. Well, I really appreciate you both for coming and speaking on this topic. It was very interesting for me to learn a lot about this, and I'm sure we'll have questions that pop up later on. But I do have some closing remarks before we go. We did have our program tonight. If you are interested, we are recording this program, so we will have it on our webinar library in case you're interested in going back and refreshing your memory. That can be found on our website, www.namiccns.org. Our next program is going to be on February 19th from 7 o'clock to 8:30 p.m., where Shawnna Parson Moore from Turning Point will further educate us on seasonal affective disorder. We also have a fun fundraising hangout event happening on February 6th. So if you are available that evening, we will be at Sketchbook Brewery for our annual Hope and Hops event. There will be live music, appetizers, drinks, musician, magician, excuse me, and all of the above. So it'll be a really fun night to hang out for a really good cause. So if you're free, please consider joining us. More information can be found on our website. And then lastly, once you log off, you will see a brief survey that will both allow us to better understand your comfort level with today's topic, as well as provide us with the data that we need to continue to raise money to provide free resources and education in our community. So we really appreciate your presence tonight. We look forward to seeing you again at a NAMI CCNS community webinar. Please take care of yourselves and each other and have a beautiful night. Bye. Bye, everyone. Thank you. Appreciate you so much. Send you an email out tomorrow.
Thank you for having us.
Yeah, have a great
Thanks for
night.
having us.
Yeah,
You
thank
too.
you. Bye.
Bye.